So it depends what we're talking about. So there's the implantable Collamer lenses, and then there's the cataract and clear lens extraction. Look, put simply, when patients come to our practice, they go through quite a thorough consent process. So we go through all the risks of lens-based surgery, including things like retinal detachment and retinal tears, infection in the eye. All of these things are super rare, but patients need to be made aware of the possibility of them in very unlikely scenarios. So we go through the kind of a risk profile, and you can see all of that on our website. And then obviously I also go through that in detail with patients in the practice, and they have a very thorough consent form that they can read as well, and a booklet. So there's the risks of the surgery, and then there's just things that they need to be aware of about the premium and all the multifocal lenses. I've kind of already touched on these, but there's the neuroadaptation period. So similar to Presbyon, you'll have a bit of that time where your brain needs to get used to the optics of the lens because it's not your natural lens. Then also we've touched on side effects of the lens, so glare and halos at night. And then most of our patients, I would say, a really high proportion of our patients are glasses free, because that's the whole point of the surgery, especially for implantable Collamer lenses and clear lens extraction. That's the whole point. So, whilst we say we can't 100% guarantee it, lots of patients are, but you have to be aware that there's still a small chance of needing reading glasses. Most of the time we can fix any distance refractive errors because we have laser here, so we can always do a laser touch-up on top of a lens-based surgery if we need to. We rarely have to do that because our lens calculations these days are very, very accurate. We find that we're within, 0.25 to 0.5 diopters like all the time. Like, it's very consistent. Don't really get many refractive surprises. And I think that's lots of surgeons now, just because, we have the Iowa Master 700 from Zeiss, which is extremely accurate. At my practice, I perform integrated K, so I actually use keratometry readings from multiple machines and I average them. So I find that from a refractive surprise scenario, whilst it's possible, it's not common. And I think patients that have had previous laser surgery, again, there's traditionally they have slightly higher risk of refractive errors because they've had previous laser eye surgery, and then you're doing a lens in an eye that's already been altered. But again, the calculators that are available now, we have the Barrett True K calculator, which is extremely accurate, and EVO has a calculator as well. So these calculators, I do a lot of lens surgery in patients that have had previous laser eye surgery, and I find the results are extremely accurate as a general rule of thumb. So I guess to summarize, there's three components. There's the risks of the surgery, which we discuss in detail. There's the side effects of the lens that we discuss in detail, and that's based on the lens that we go ahead and select for you for your surgery. And then there's the expectation to be glasses free, which most of the time we can deliver, but obviously there's a small chance that in certain scenarios we can't, and patients have to be aware of that, because in life there's never any 100% guarantees of anything.